When we are getting ready to pass our medications, we want to make sure that we have all of our tools available to us, such as gloves and tissues. This also includes making sure that our space is large enough for us to work on and is clean and sanitized. We also want to make sure that we have our med cups, water, spoons, and any other mixtures that a person might need for taking his or her medications. For example, some people take their medications in applesauce, pudding, or yogurt. Make sure that you also have your blood pressure machine ready, as sometimes this might be found in some of the locked cabinets. You may unlock any combination locks or key locks on the cabinets, but should keep the lock bar down on any cabinets you are not currently using. Grab out your medication administration record and your first set of medications to begin. Not all of the med cabinets are set up in this way. Sometimes you'll see that a med cabinet is set up with a box instead of a file cabinet. Make sure to get familiar with your med administration area. After you have gathered all of your tools, make sure to relock those cabinets, and then it is time to hand sanitize or wash your hands.
Okay, actually, you can go ahead and pause.
It's time to review the medication administration record. We will have the picture of the individual. We will have any vital tracking sheets for blood pressure, weight, glucose, and sometimes for any pulse ox and other vitals that need to be tracked, medication update sheets for any medication changes that have occurred, the medication administration record, and side effect sheets. It is important, as medication changes occur, that you read and acknowledge the medication update by signing with your full name, your first name, last name, and title on those medication update sheets to acknowledge that you read and understand any of the medication changes that occur. Failure to do so is considered a documentation error with DHS Rule 116. Now it's time to look through the medication administration record for any medications that need to be administered at this time. Compare those medications against the medications that you have pulled from the drawer. Make sure that you have all the medications that you need for this medication administration time. You may have overlooked one or two medications, which may be an eye drop, an ointment, or even a powder. Make sure to go through every single medication administration record sheet, as some new medications do get added to maybe the last page of that medication administration record. Either wash your hands or use hand sanitizer to clean your hands. Then get your med cup and any vehicle such as applesauce or yogurt that you might need to crush or mix medications in for administration. Check the medication administration record against the medications that you are preparing to ensure you have the correct medication for that person at that time. Look at the bingo card to make sure you are punching out the correct day. Hold the med cup directly under the area you are punching out and push the medication fully through the lining into the med cup. Repeat these steps for all medications you are administering for this med administration time. Once you have finished administering the medications, come back to the medication administration record and check the medications that have been administered against the medication administration record. Then it's time to initial for those medications that have been administered and do a final check through all of the medication administration record to see if you've missed anything. If you're all finished, it's now time to put the medications away, lock your cabinets, and then to also put your medication administration record away and any other supplies that you have used away. While you are passing meds, do not answer any phones or check any text messages. Ask residents and other staff to wait patiently a moment while you take care of the medications, and then you'll answer any of their questions once you're done. Try to block out all distractions. Let's watch a bit of that video again, and this time I won't block out any of the video so you can hear all of the noises that were going on in the background. A lot could go wrong if we don't follow DHS 4116 policy and procedure for medication administration. Let's watch our med passer as he passes medications during this med administration time. After this clip, pause the video and talk with your nurse educator about this clip to discuss what happened and what could go wrong if you pass medications like this med passer is.
Who else needs medics? Wait, stop there.
Okay, let's pause here. Let's talk about what the med passer did incorrectly and what could go wrong due to this med passer's actions. Uh-oh, he's at it again. Let's take a look at what he's doing now, and we'll talk after this clip. Let's pause here and talk about what the med passer did incorrectly and what could go wrong due to his actions. Last clip. Let's see what's going on in this one. Let's pause and talk about this. What are some very key things that you've seen about what the MedPasser did incorrectly and what could go wrong here? So the last couple notes regarding medication administration. Make sure to read the medication update sheet. Remember the 7 rights of medication administration. You must use black ink while administering medication. If you make a mistake, draw a single line through the mistake, mark an error, then your initials. Use the following initials and abbreviations that are listed below. If the medication is not available, call the RN. Be sure to call the RN and let her know that a medication like ointment, cream, inhaler, nasal spray, Tylenol, Metamucil, Clearlax, birth control, any of those might be running low, so it can be reordered. Don't wait till it's out. Do not leave any medication spaces blank on the medication administration record or on any controlled substance sheets. Be sure to sign the PRN medications as you are giving them. Make sure to check all BP and pulse before giving the medications, then sign the MAR and log the results. And your signature, initials, and title need to be entered the first time you administer medications for each new medication cycle. We appreciate all of your hard work and cooperation to ensure the safety of those that we serve. Thank you for becoming a new MedPasser here at Little City Foundation.